here. I'm super excited about the conversation we're going to have today. For those who may not know, I am Councilman Christopher Iway, Council Chairman of the City of East Orange. I want to take the opportunity to thank the partnership of maternal child health, as well as the Greater Newark Healthcare Coalition, for giving us an opportunity to kind of have a dialogue and conversation about an issue that is of pertinence and importance to all of us, especially in the Greater Newark area, Newark and East Orange and surrounding communities. And I'm joined here with someone who is esteemed and an honor to be here with a great colleague of mine in Newark, and I'm gonna allow him to introduce himself as well.
Thank you, Councilman. It definitely is a pleasure being here with you. My name is Larry Crump. I am Councilman at Large for the City of Newark. Been a councilman since August of 2021 and was just elected to my first 4-year term this May. Looking forward to working with the City of Newark and in particular for this presentation today, working with as a Hear Her ambassador and working with, again, as the councilman said, a partnership of maternal and child health and the Greater Newark Health Care Coalition.
Yeah, so this opportunity that has been bestowed, to myself and the great Councilman Crump is definitely something that I'm looking forward to. The opportunity to be a Hear Her ambassador. A lot of times I want to ask you, why would you advocate, or why would you put your name and your platform behind such agendas and campaigns and so on and so forth? And the answer to that for me personally, the Hear Her campaign is quite simple. Life starts with her, right? Life is better because of her. And so it's important that we do our part to make sure that all of our hers of importance in our community, our mothers, our sisters, our aunties, our daughters, that they have all the full support for their greater health, mental and physical, and because we know that's an investment that will pay dividends to the greater community, and that we know that the hers of our community makes our lives better, and that we stand on with their support and so on and so forth. So that's the simple answer for me.
Yeah, and I mean you hit the nail, the head of the nail. Without her, we wouldn't be here. So therefore, how could we not be involved in something that is going to affect a woman's pregnancy, and being able to advocate on behalf as a man to help the women in not only just in our lives, but in our communities, to have a good pregnancy and end with a healthy child. It's just critical, particularly in our community. We understand the issues regarding prenatal care and the lack thereof of sometimes the necessary examinations or information that we need in our communities. So to be a Hear Her ambassador, hopefully as a Hear Her ambassador, it will help us make sure that the men who are around pregnant women hear them and help them, so that at the end of the day, they have their natural pregnancy and a healthy and hopefully healthy child is born.
Yeah, I mean, I think you hit it on the head as well, Councilman, when you speak to the impact of our community, right? We already know that mortality rates are rising, nationwide, but even more in our community. In Jersey, a New Jersey mother is 7 times more likely, a New Jersey African-American mother. That's Newark, yes. That's East Orange, that's Irvington, that's Great Essex, right?
Absolutely.
So, our sisters who are pregnant are 7 times more likely to die than their white counterparts. And that's a staggering statistic. And obviously there's so many other issues that, that impacts that, but the stop of that can start with us listening, for us paying attention, for us advocating, us supporting, and being there for our sisters when they're in such a vulnerable, time, in terms of pregnancy.
Absolutely. And speaking personally as a father and a husband, my wife is funny, and I'll tell a story maybe at the end, but I was there. And I'll say this: when you're going through the pregnancy, everybody has this book. Everybody gets this book. I won't necessarily mention the name now, but everybody knows the book about going through a pregnancy. But it's more than just reading the book. It's about listening to what's going on with your significant other, or in some cases, just somebody who's there in your household, or somebody you know that's pregnant. You need to know what's going on. You need to know if they don't feel well, what are they going to do? You know, we're taught to kind of take care of ourselves, and we're just going to handle it. We're not going to go get some help. You know, we're tough. We do what we need to do. But the reality of it is, we have to really think about what's going on with your body, or the woman needs to think about what's going on with their body, and we need to be there to say, "Are you okay? If you're not okay, what's the next step? What are we going to do? Let's call your doctor." And not just say, let's call your doctor, but be supportive through that process. You know, one of the things with my wife, I went to almost every examination she had. I think I missed one, and that was because of some long story, but I only missed one because I think it's important to be there, and not only to be there for the person that's pregnant, but to hear what the doctor is saying, because the doctor can be saying things that are important for the woman's health later on. And we need to be prepared for that as somebody who is, like I said, in my case, it was a spouse. Be there for my wife. When she's not feeling well, what does that mean? If her feet feel, if she says my feet are swollen, what does that mean? If she's stomach is upset, what does that mean? You know, and a lot of other things, you know, bleeding, other things that can occur. What does that mean? And we need to know, as men particularly, we need to pay as much attention to that pregnant woman that we can, because, you know, we shouldn't sit there and watch TV. You know, I like to watch ESPN, and sometimes my wife is in another room, you know, but while she was pregnant, I sat with her and we watched whatever she wanted to watch, because I wanted to make sure, going through this pregnancy, that I was there to support not just her through the pregnancy, but making sure that in terms of her medical condition, that she was okay. Because at the end of the day, you know, you would want a healthy baby. And to get there, there's a part of the process is making sure that those steps are taken to see the doctor, for prenatal vitamins, et cetera, to see if, okay, she's not feeling well. Why is she not feeling well? What are the steps that we need to take, whether it's going to the doctor, whether it's just calling the doctor. But I just think it's important that we hear her, as this campaign is all about.
You're absolutely right. So, you know, you're talking from an experience point of view, and I know for me, and I think this is why it's so important for us to have the conversation as men, across the line, all of us men, and even generationally speaking, right? You know, I haven't been blessed yet to be able to be a father. I'm a godfather of many, though. And I think, you know, talking to, you know, big brother Crump, you know, who's been through it, he can tell me some of the same things I need to look out for, right? Because I haven't been able to experience it myself yet with my spouse, right? But, you know, for those, again, those sisters and those aunties, I think we got to realize that we have more opportunity than we think. A lot of times we just think we're obligated to just our spouse, but we really should care for all of the women in our community. And so it could be your sister, it could be your cousin, it can be your bestie and that best friend of yours, and so on and so forth. And we know that our queens they're resilient. Our queens are so resilient, and they have a tendency to push through, right? They have a tendency to just kind of ignore, you know, what's going on with them, just to make whatever happens that needs to happen, right? And so they would ignore that headache. They were ignored, you know, they feel a little dizzy. But if we, as the men in the community, as the men in their lives, as their spouses, as their brothers, as their uncles, as their fathers, we'd notice, like, you know, you had this headache for the last few days. Have you got that checked out yet? Or, you know, you're swaying, sweetie, you know, are you dizzy? You faint? You know, what's going on? Maybe we need to get that checked out. That might really give an opportunity for us to stop something before it can even start. And so I think it's important for us as men to have these conversations among each other, know what signs to look out for, in terms of in our women, in terms of their health, know where to turn when we see those signs, who to call, you know, and how we can best be supportive. And I'm just glad that now with this time, we know the importance of that, to have these conversations, so that, you know, for the younger men, you know, behind us, you know, they should feel comfortable enough to ask, you know, their brother, their dad, their cousin? What's some of the things they look out for? And that the women know that they have the full support of all the men in their community.
Yeah, and I echo those sentiments. I also want to say, I think it's important that the women understand, or I should understand, but lean on your men, lean on the men in your community. Don't be afraid to go to them and say, you know what, I'm going through this. I need your assist. I need your help. I need you to be there for me. Don't be afraid to say, you know, I'm not, tell them I'm not feeling well, that I want to call, maybe we need to call the doctor, or we need to do something about it. Because as you know, we'll step up. I will tell you that as a man, we'll step up and we'll be there for you and to support you through whatever you're going through. You know, we all want our children to be there and succeed. We want to make sure that they come out. Well, I should say come out. Make sure that they're born and and become a fruitful member of society. So we have a vested interest. You know, to me, it's quite personal, not just because of my family, but in general. I want my community to succeed. I want the people in my community to be healthy and to be happy and to be prosperous. And this is an opportunity for us to do that as Black men, particularly, and as men in general. And so I'm excited. I truly am excited about this opportunity to be on this campaign, because I hear her. And it's funny that this is happening right now. It just seems like everybody around me is getting pregnant. So I have so many people
That's
I
that
work
pandemic.
with now. I guess so. That's what it is, right? It's this pandemic babies are coming around, and so it goes past just my family. Like I said, it goes to other people I work with and deal with. And in fact, the other day I just asked someone. I just asked her, "How you doing? How you feeling? Everything good?" You know, and it doesn't take much for you to do that. You see someone, someone who's pregnant, just ask them how they're doing.
Yes, sir. Yes. Well, with that being said, I think it's important, they hear her campaign, you'll be hearing and seeing a lot from them, and hopefully a lot from myself, and Councilman Crump and other gentlemen who are definitely going to sign on as ambassadors, and with the education of, the Partnership for Maternal Child Health, and the Greater Newark Healthcare Coalition, learning all the signs to, look out for, learning the approaches and where to turn when we see some those signals and those signs, so we can avoid the complications. And so, we would be remiss if we didn't share. For example, fellas, if your woman is complaining about a headache that she's had for a prolonged period of time, and she's been pregnant, or she's been dizzy, or she's running a fever, those are signals that may, signal complication and require attention, and so definitely look out for that. Those are the physical signs. Also see and look out for some of the emotional and mental signs too. Postpartum depression is a real thing, and so on and so forth. So when you see a change of mood, outside of norm, maybe I should say that, but if there's any change of mood, or you find the women in your life is saying things that are a little bit off, or so on and so forth, as Councilman Crump said, sometimes just asking, are you okay, can go a long way and open up the door. And so we want to encourage all the viewers, and particularly the gentlemen, to look out for the Partnership of Maternal Child Maternal Child Health, and the Greater Newark Healthcare Coalition for more tips, more suggestions, more education on what to look out for, and follow all the social media handles and so on and so forth. And so we're looking forward to being out there and signing on more ambassadors. So if there's any other gentlemen out there that want to be ambassadors as well, please reach out. Reach out to the Greater Newark Healthcare Coalition and the Partnership for Maternal Child Health, and sign on, because we can use all the gentlemen. This should be a whole mission of ours, and this is one of the ways we can take back our community.
Absolutely, I feel the same way. I'm glad you said that. I mean, it's important for men to be a part of this, not just the two of us. And I know there are many men out there who are probably watching right now who would love to participate and be an ambassador to help. As particularly as Black men, we need to take care of our queens. Yes, and to take care of our queens, we need to hear them. And being part of as an ambassador for the Hear Her campaign is essential for our success, I think, in our future, for our family, for our generations, and for our community. So I'm excited about it. I look forward to working again with you, Councilman, and with the Partnership for Maternal and Child Health, as well as the Greater Newark Health Care Coalition, to doing a lot more of advocacy and giving out information and making sure that we take care of our women in our lives.
Indeed, agreed. Thank you, sir. I'm looking forward to working with you also, big brother Crump. And let's get this off the, let's get this whole show going. So thank you, Greater Newark Healthcare Coalition. Thank you, Partnership for Maternal Child Health. We are thankful for this opportunity, and we're looking forward to, advocating more and being out there more. Thank you so much.
Thank you.